You're listening to Show Me the Evidence.
Hi, everyone. I'm Bethany.
I'm Olivia.
I'm Casey.
And I'm Grace, and this is Show Me the Evidence, a podcast about vaccines. We are four Masters of Public Health students at Yale School of Public Health. Bethany and Olivia study social and behavioral sciences, and Casey and I study health policy. And we are all happen to be best friends. And we love talking in school and out of school about vaccines. And we thought, why not bring it into a podcast to share with all of you?
Lately, we've been seeing kind of different information on social media, especially TikTok, really asking questions about what vaccines are, what they do. We're seeing a lot of kind of fear and misinformation that's out there. And so we thought, what better way? You know, we're all 24 years old. We have, a little bit of science behind us and wanted to kind of be, a source that's comfortable and easy and approachable to talk about vaccines.
Yeah. And while all of our dreams may have always been going into public health, it might not have been to start a podcast. So you might be asking, why are we here? To be quite honest, we are doing this for a class. We're a little bit sick of writing final papers after 2 years of our program and wanted to find a way to really have an impact on our networks of just talking about the science that we know and kind of just like meeting the moment with all of the false information being spread about vaccines. We really wanted to use our education and ability to chat for a long time and just come together and kind of have like a more candid and transparent conversation about vaccines.
So episode 1 is going to look a little different. It's all 4 of us in this episode, but normally the next 4 episodes are just going to have 2 of us featuring on the episode with the different experts, but we're going to feature vaccine policy experts, a pediatrician and immunologist, a parent, and global health experts. And then we're going to conclude it by it being the 4 of us again in conversation.
So I heard a talk from Paul Offit the other day, who's like a vaccine expert. He said, you're more likely to die on your way to get a vaccine than you are to either die or have an adverse outcome or effect from a vaccine. That really, really struck me.
I think it's super interesting. I think we should unpack that. Is that because there's such a high rate of car accidents in our country, or is that because vaccines are super effective?
We do know that car accidents and injuries, are high, especially in the United States. But we have seen decline in recent years. What the most striking kind of comparative statistic is how truly safe vaccines are. And so when you're comparing that, we see that it is incredibly rare for anything to happen, let alone die from a vaccine. And so I think that's why I think the fact is like so striking and outstanding to me, is because there's a lot of confusion around vaccines. And I think one of the first things you hear is that, I'm worried to get my child vaccinated. Like, what if something bad happens? And it's like, well, did you go in your car to the grocery store today? Something bad could happen then too.
Yeah, there's risk in everything.
There's risk in everything. And this is such a minimal risk for vaccines.
When we talk about vaccines, it's important to focus on what the data actually shows us about safety and effectiveness. So serious side effects are extremely rare. For example, severe allergic reactions occur in about 5 cases per 1 million doses. And all of these adverse reactions and safety is continuously monitored by systems run through the CDC and FDA. So scientists are aware of what's happening and continuously monitoring to see if there are trends that are concerning. Second, vaccines are highly effective at preventing severe outcomes. COVID-19 vaccines reduced the risk of death by around 90% during early rollout, and the flu vaccines reduced the risk of ICU admission by about 26% and death by about 31%, all among hospitalized individuals. Third, the overall impacts of vaccine are massive. I feel like we constantly talk about how vaccines are one of the biggest successes of public health, which is why...
the first thing you learn in class.
Yeah, exactly. It's why we're all obsessed with them. I feel like when people hear public health, they often think about vaccines. And routine childhood vaccines in the U.S. are estimated to prevent about 472 million illnesses, 32 million hospitalizations, and over 1 million deaths across the lifetime of vaccinated children. And then finally, vaccination protects not just individuals, but entire communities For diseases like measles, we need about 95% coverage to prevent outbreaks, meaning that even small drops in vaccination rates can quickly lead to disease spread. So while it might not feel like an individual decision is making a big impact, it actually is, because we need that high coverage rate. Vaccines are closely monitored, very safe, and one of the most effective tools we have to prevent serious illness and save lives. So I will put my paper down because obviously we don't just want to read information off in this podcast, but it's important to also make sure that we're like talking about the facts when we talk about this, because vaccines are so rooted in science and so evidence-based, and we're lucky enough to know so much about them that, you know, we want to make sure we're talking about that.
I think then that it's really interesting when we think about all of the evidence around vaccines and how effective they are and how safe they are, that so many people in specifically the United States right now oppose either vaccines in general or vaccine mandates. And I just think it's astonishing when you just compare everything that we have and then the kind of political discourse surrounding vaccines right now.
I just actually read a KFF survey and article that kind of talks about overall public trust, both within, you know, vaccines specifically, but also just like public trust in public health institutions, and specifically CDC, FDA, the government, and they're, as we all know, I mean, we're studying public health, and one of the major things that we are fighting is that lack of trust. But it's at an all-time low right now. But a huge part of it was showing that it is, you know, down to party lines of who they trust. It was nice to, the survey did show that, you know, people still see their pediatricians and PCPs as their most trusted source of getting information.
We're hearing all of these really polarizing things about vaccines right now, and it's giving the impression that people are like very split on vaccinations, and that like half people are, half people aren't, when like that is really just not the case at all. And I know I said I'd stop citing facts, but
You're a fact girl.
I'm a fact girl, and our good friends at the Harvard School of Public Health recently did a study on this and found that 91% of the public believes that vaccines for childhood preventable diseases are safe for children. And I feel like people just don't get this impression, because the ones that then are against it are like the loudest in the room on TikTok and X. And it's like makes it more acceptable for then other people to not want to vaccinate, because they're like, oh, well, most people aren't vaccinating or whatever. But it generally is like a very high percentage of people that trust in vaccines and trust their PCP. And, you know, it's fair to have questions.
When we have these sources that have historically been really accurate, but now they're starting to deteriorate, the information you can't necessarily trust, a lot of people then are turning to social media, because everyone has some form of social media. It's really accessible. It's really easy to just say what you're thinking, and just kind of put opinions, facts, whatever it might be out there. And most then people who are on social media are unable to necessarily tell the difference between fact and opinion, especially because you're looking at this information and then you kind of move on with your day. It's not you're not necessarily doing a deep dive on every post that you see. And so if any of us were to just post a random opinion that we have and disguise it as fact, I'm sure plenty of people would would just take it at face value. And so I kind of wanted to do some research in terms of the presence of social media related to false information, specifically on the topic of vaccines. And I found, which I think is probably unsurprising to most of us, that negative sentiments spread much, much faster than like fact and positive sentiments. And there really is something to be said about fear, which I think is really grounded in, or vaccine hesitancy is really grounded in fear, because it's all about those adverse outcomes. And so social media winds up being really the perfect ecosystem for fear to spread, because you see something scary and you send it to your friend and you're like, wow, did you see this new thing about vaccines? And someone in this state had a severe outcome. And so I think the combination of making it so accessible to see information, but also the inability to necessarily fact check things on the spot makes it spread like wildfire. And so I think it's really interesting to think about going forward in an age where social media is ever present and probably just only going to increase. What happens? How do we combat this kind of spread of information that we can't necessarily verify? Especially when research also tells us that things like censorship certainly don't work and just make people turn to alternate sources.
Yeah. Well, I was reading something about Facebook, and in 2020, it was actually 2021, when the COVID vaccine was starting to roll out. Now we hit 2022. We're really trying to get most of America to become vaccinated, and we see a lot of pushback. Facebook became this echo chamber. And it was incredibly hard to filter out what was real or not. We saw like these like anti-vax groups forming, all of these posts. Facebook actually got so much backlash from like public health and experts that they have put in like tracking, like AI tracking that takes down posts. And so I think, that information is going to be always out there.
Yeah.
And so it really comes down to what you're seeing and do you believe it? And something so important as your health, do you listen to the mom on Facebook? And I'm not saying it's bad to like see things and, question it, but I think it's that idea of like, do question it, because you shouldn't trust everything that you see on social media.
And it really is like so convincing. Like you watch it and you're like, oh my gosh, I actually know this isn't true, but it's so convincing. We watched that video the other day too. It was showing like the rates of different vaccine or different diseases before vaccines, and it was like increase, and then it would show the vaccine and just drop off. So I feel like vaccines are kind of a
victim of their own success.
A victim of their own success. Just like public health. But like people don't see when they don't get sick, but you see when you do get sick. So vaccines like are kind of at a detriment in that sense of like you can't see the success of it. So people almost take it for granted. Like it's in none of our lifetimes have we seen the like real impacts of like polio, for example. And so people might be like, well, then why do I need the polio vaccine? Because no one gets polio. But it's like, well, no one gets polio because we all have the vaccine. I think it's important to note too about like the individual cases of adverse effects of vaccines, like these moms who are mobilizing to say, my child XYZ after getting a vaccine. Like the power of a story of an individual is so powerful, and it really evokes a lot of emotion out of people, and you're able to empathize with them. You're like, oh my gosh, look what that mom went through. I don't want my child to go through that, because you're able to see a like personification of that experience. Whereas that doesn't exist for the benefits of vaccines. Like it's not like moms are going around saying like, look, like little Joe like got exposed to the measles in this, and he didn't get it because he was vaccinated.
There's like a trend going on TikTok right now that I'm on vaccine TikTok. And I love it. It actually does what you're saying is not out there.
I haven't seen that.
So you might have seen this on TikTok. It's all over mine. But it's a mom or a dad holding up their baby, and they're like crawling around, and it's the trend where it's like my baby before vaccines, and then it says my baby after vaccines. And it was a trend that was kind of rooted in negativity, where it was like then showing maybe a child having an adverse reaction, which a lot of times I also want to clarify may not be connected to a vaccine.
Totally.
Vaccines, and we're going to get to this in a little bit about myths and stuff, but vaccines oftentimes are done within the first few months, and then, at different checkpoints throughout the child's life, which can really correlate to other illnesses and things. However, I don't want to negate anyone's experience. But anyways, the trend is that we're seeing, child before vaccine and they're like all happy. And then we see child after vaccine and they're still all happy.
Mm-hmm. Yeah.
And that makes me really
that's a cute
happy.
trend.
Because I'm like, they're fine in an hour. Like they weren't really happy that you poked their arm. But,
of course.
I'm not happy when I get my arm poked either.
Yeah.
But I am happy when everyone else, in my house gets the flu because they didn't get, vaccinated and I don't.
Mm-hmm.
Yeah.
And that's where it's like, okay, that's where I think it's important because I'd much rather, not get an illness and like take that, 0.0001% risk than have the risk of getting a disease that could kill me.
Mm-hmm.
Yeah.
I do think for something like the flu too, though, that some people don't see the value of vaccines when they end up getting sick.
Still the flu. But it's usually mild symptoms.
Totally.
And,
the point of vaccines in those cases is like in a lot of them, like measles, 97% effective. Mm-hmm. You probably won't get measles.
Yeah.
But for something like the flu that is still very effective, or COVID, like you could still get it, but you're not going to go to the hospital and like have all of these really severe outcomes. Like that's what you're being protected against as well as like actually getting it.
Going to the measles outbreak currently happening in South Carolina and in the past, a few years in the United States, seeing a resurgence, most of the cases that have end up in hospitalizations, they're all unvaccinated, whether it's children or adults. They're usually unvaccinated. The ones that are vaccinated, they are not ending up in the hospital with intense symptoms. Going to the flu, a huge cause of that is because of a lack of trust because they're seeing that, the flu, like the vaccine continually changes because of the different strains that they're having, that scientists are having to modify for the different strains. But they think that there's something wrong with the vaccine because it's continually changing.
Yeah. It's like hitting a moving target, basically. They say we have to, I think we use Australia's data because they hit winter before us to predict what, so we're not even, we have to base it off of basically a hypothesis and theory.
But also I heard a good analogy for this the other day, Casey did too, of like we're not taking, if the flu vaccine is a Word document with like, I don't know, 1,000 characters in it, we're not like converting it into an Excel for next year's flu vaccine. We're like changing one letter in it. It's like almost the exact same. We're just changing it for the variants.
Yeah.
So it's not like this continuously like changing thing.
New.
It's just like
that's the same with the COVID as well.
Yeah,
which I think is important. The COVID is also just slightly changed as we see different variances.
Yeah.
I mean, I'm sure a lot of people who are listening like have had the COVID a few times and they're like, I don't understand. I've had COVID before. I've had the COVID vaccine. Like, why am I getting it? You're likely getting a different, like slightly different strain.
Yeah.
Because like they like the disease itself, it like changes and morphs and mutates and that can.
And importantly, you're not having severe adverse outcomes.
Yes.
Exactly. You're not in the hospital.
Yes.
Yeah, you're okay. Like you recover.
Yeah.
Totally. Casey, I would love to hear about some of the things that you were seeing on TikTok. I know that you did a little bit of a deep dive into like what information is being spread. So let's hear some of the myths that you saw.
Yeah. And I will say that they're convincing. So I just want to like acknowledge that if you're also hearing them, that they can be really confusing. So hopefully this is a resource. One of the main, false or varying information out there is what is in a vaccine. And I was like, wait, do I know exactly what's in a vaccine? But really it comes down to science. And there are multiple components in a vaccine. And so I like to call them ingredients because that makes sense to me. I like to cook. And so each ingredient has a different scientific purpose. All of these ingredients are in this tiny little dose that goes into you, and they all have a very specific scientific purpose, and that everything that's in a vaccine is at the smallest amount possible.
Yeah.
And so that kind of brings me to the formaldehyde and mercury. Yeah. Formaldehyde is naturally produced in your body. And the amount that is in vaccines is extremely small. It's been tested over years and years and years. And the amount that's in the vaccine will be cleared out of your body in 30 minutes.
Wow.
And so that is how like minute it is. Yeah. The second is mercury. And so there's different kinds of mercury. And I don't know anything about mercury, so like I'm not gonna, share things I don't know. But there's basically two different kinds.
Yeah.
So the kind that is bad for us is called methyl mercury.
Yeah.
what is in vaccines and which actually has been taken out of most childhood vaccinations because of the fear that has happened in the 90s is ethyl mercury. And the reason that formaldehyde and mercury used to be in it or in it in small amounts is actually so that vaccines are able to be non-perishable and also can protect against contaminants. And so we know, your vaccine travels from the lab it was created in into a warehouse. And also, other countries need vaccines, and the U.S. produces a lot and is able to ship them elsewhere. So we actually need ingredients that allow us to, give vaccines to others.
Totally.
And so that's why it's in there. And I think it's important to kind of understand that.
And it's so much easier when you have numerous doses in one vial because you're saving yourself having to make completely new vials for every single dose.
Exactly. Yeah.
So it's just protecting from when you poke that hole in to draw the first dose, that then what's remaining is not necessarily going to be contaminated, and then you could get sick with some bacteria.
I think I've heard concerns too of people not wanting like a live virus for the certain vaccinations that do include live viruses, of not wanting that in their body. But it actually is it's a minute amount. Our bodies naturally are exposed to so many more pathogens every day that, like, when you're looking at the viral load and like the amount that's going in, it's just like prepping your body to be able to fight that pathogen. That's what vaccines do. It's like giving you a head start to learn how to build that immunity.
Well, and that kind of brings me to another myth that's out there that a lot of new moms are kind of like dealing with is, do I give my child the 1-year vaccines? And a lot of new moms are saying, I feel like it's better for my child to have the disease and become immune than become immune through vaccines. A child's a child, like they can get a disease.
Yeah.
And that, I think, can be incredibly harmful because we know how dangerous these diseases are.
It's like chickenpox parties.
Exactly.
Yeah.
Like measles is incredibly, incredibly dangerous. And so I think, again, really understanding the importance of how safe a vaccine is and how unsafe these diseases are.
Yeah.
And children get sick, they get the common cold. That's normal. But what they really should not be getting is measles.
Yeah.
And well, the flu as well. I mean, people say like my child can just get the flu. The majority of vaccine preventable disease, like hospitalizations, are from the flu every year.
And I think it's incredibly sad because I think like with the mentality of like my child can get the disease and then they'll become immune, it's because we forgot, like you said earlier, the vaccine, what the vaccine's a victim of its own success.
Yeah.
I mean, the reason that people think that is because they don't remember what it was actually like when it was rampant. And, people were dying or hospitalized. And so we forget that. And that's where, the importance of talking to your doctor and finding trusted sources of information, because your child will be the victim of that, without actually having accurate information. You don't know actually what would happen.
And I do want to, throw in a statistic because we are kind of talking about, getting sick as a part of childhood. More than 226,000 people are hospitalized from influenza. 20,000 of those are children. And 36,000 people die from influenza each year. And that's the flu. And so that could be prevented by getting the flu vaccine.
Well, and another stat to throw on you, Casey, is that 40% of the people hospitalized, the children hospitalized for vaccine preventable diseases, are immunocompromised in some way, or medically complex children. And so these are the kids who can't get the vaccine because their body,
For one reason or another.
Yeah, one reason or another. They might have childhood cancer. They might have some like immune problem. And these are the people that herd immunity needs to protect. And then they're the ones who pay the ultimate consequence when these vaccination rates drop.
Yeah. We're going to talk about herd immunity more in depth in another episode. But I think that's where, it's incredibly important to know or to realize that, when you're making vaccine decisions, like, while it feels individual, it feels like, okay, this is only going to impact my child, this decision I'm making right here in the doctor's office. Vaccines are it's a intervention that's
societal
going
impact.
to, it's
Yeah.
community.
Some of the other myths that I found interesting. You mentioned, RFK Jr. and his, entering the vaccine conversation and his statements about vaccines and autism. And this is something that I find really scary because it truly is false information.
Yeah.
It is not accurate. The information he has is not true. What is in a vaccine, again, to prevent contamination, to allow it to interact with the other ingredients, is thimerosal. And that is what was seen. How am I saying? Thimerosal. She knows. Thimerosal.
Thimerosal.
Thimerosal. It was seen in a study that was done in 1998, and it showed a link between the MMR vaccine and autism. This was bad science. It truly had nothing in it that was correct.
It was also 14 individuals.
Yeah.
It was 14 individuals.
Any
And so
Why don't you
scientific
talk
study.
about,
Yeah.
an actual scientific study that,
So an actual scientific study that was done was a meta-analysis, which, if you want to explain that in just a second, is with over 1.25 million children. So let's compare 14 children with actually no link because it was incorrect the way he did the study, compared to 1.25 million children, and there is no increased risk with vaccination and autism. And I think that is incredibly powerful.
and maybe we could pivot to, talking about what makes a good study and a bad study.
Yeah.
When I'm reading the article, how do I know if it's legit?
Well, first of all, I would say make sure you're going to an actual scientific paper.
Okay.
Like,
Yep.
we're not just trying to go to mom and pop's website about their experience. We're going to a peer-reviewed source.
It
Okay.
should probably not end in a .com. That's
Yeah.
usually the best way
That's
to
a good-
know.
yeah.
Okay.
Like
It's
a
good to know.
.org would be a really helpful
Yeah.
way to know.
I think the importance of science, too, is knowing your limits, and we are not experts in everything, which is why we're going to be bringing on experts who do this for a living and have lived through some really important experiences, and just be getting more information from them. So it's important to know when you are the expert in something and when you need to pull in other people.
That was actually a perfect segue, Bethany, into our next episode, which is featuring Dr. Jason Schwartz. It'll be Olivia and I with him.
Who is Dr. Jason Schwartz?
Well, let me tell you. And Olivia, you can help out.
Okay.
But he is a vaccine policy expert. He
Yeah.
has been studying this his entire career. He is often featured on, TV. He is on a ton of peer-reviewed journals and featured in New England Journal of Medicine. He's got a lot of work out there that you all can read and that we will link.
Yep.
But he is seen as a vaccine policy expert.
And I also just want to kind of put a reminder, if you were curious about any of the information that we said in this episode, all of the research that we do in this episode and all of the consecutive episodes will be linked in the description. This is information that we find is important. It is trusted information. If you are confused, these are great sources to learn more. And as always, we encourage you to do your own research. Be careful, be cautious about what you're seeing online. And we hope that you continue listening to see what more evidence we bring.
Yeah.
This
was
is Show Me the Evidence.
This was Show Me the Evidence.
Yeah.
Great first episode. We're podcasters now.
Yep.